Good morning, everyone. Thank you for being here today. I am honored to speak with you about an issue that continues to affect millions of people around the world. This is the HIV or human immunodeficiency virus. Despite the progress we've made in medicine, education, and public health, HIV still presents challenges in many communities. However, with awareness, education, and strong commitment to prevention and support, we can significantly reduce the impact of this virus. Today, I will take you through an understanding of what HIV is, how it spreads, how it's treated, and most importantly, how we can prevent it. Along the way, I will discuss some common misconceptions about HIV, as well as some of the global efforts being made to fight it. What is HIV? Now let's begin with the basics. And this question, what exactly HIV is? HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the body's immune system, especially the CD4 cells, or also known as T helper cells. These cells are vital for the body's defense against infections. As the virus destroys more of these cells, the immune system becomes weakened, leaving the body more vulnerable to other infections and diseases. If it were left untreated, HIV can progress to AIDS, or should we say, acquired immunodeficiency syndrome. At this stage, the immune system is severely compromised, and individuals become susceptible to life-threatening infections and certain cancers. However, it is important to note that HIV does not always progress to AIDS, and with proper medical treatment, people living with HIV can live long and can live healthy lives. Now let's talk about how is HIV transmitted. So HIV is primarily transmitted through certain body fluids, including blood, seminal fluids or semen, vaginal fluids, rectal fluids, and breast milk. It is most commonly transmitted through, first is the unprotected sexual contact. This includes vaginal, anal, or oral sex. It is particularly common in unprotected anal sex, where the risk of transmission is higher. The second one is sharing needles. People who inject drugs and share needles or syringes are at risk of HIV transmission. Third one, mother-to-child transmission. A woman who is HIV positive can pass the virus to her child during pregnancy, childbirth, or breastfeeding. And the fourth one is the blood transfusions and organ transplants. In places where blood screening isn't routine, HIV can be transmitted this way. Although this risk has decreased significantly in many countries due to rigorous testing practices. It is important to note that HIV is not transmitted through casual contact. You cannot get HIV by shaking hands, hugging, kissing, or sharing utensils. HIV cannot survive for long outside the human body. so casual interactions do not pose a risk. Now let's proceed to the symptoms of HIV. In the early stages of infection, many people do not show symptoms at all. This is why regular testing is so important. When symptoms do appear, they are often flu-like and can occur 2 to 4 weeks after exposure. This period is called the acute retroviral syndrome or ARS, or primary HIV infection. Symptoms may include fever, fatigue, sore throat, rash, swollen lymph nodes. These symptoms are not unique to HIV and could be attributed to other illnesses, which is why people may not immediately suspect they have the virus. This phase is often short-lived, and after it, many people don't have symptoms for years. The only way to confirm whether someone has HIV is through testing, which brings us to the next critical point. So that is the testing and diagnosis. Now let's proceed to the HIV testing. Why it is important knowing your HIV status is the first step in taking control of your health. Testing is confidential, quick, and simple. There are many types of tests available, including rapid tests that provide results as little as 20 minutes. Getting tested regularly is especially important for people at higher risk of HIV, such as people who have unprotected sex with multiple partners or with partners whose HIV status is unknown. Second, people who inject drugs and share needles to others. Third, the individuals who are pregnant, as early testing can prevent mother-to-child transmission. If you test positive for HIV, there is no need to panic. Early diagnosis and treatment can prevent the virus from progressing to AIDS and protect your overall health. How far we've come, now let's talk about the treatment. When it comes to HIV, the good news is that treatment has come along the way. The main treatment of HIV is antiretroviral therapy or ART. ART is a combination of HIV medicines taken daily that significantly reduce the viral load or the amount of HIV in the bloodstream. With ART, people living with HIV can achieve undetectable virus loads, which means the level of HIV in their blood is so low that it can no longer be detected with standard tests. An important aspect of ART is that it doesn't just help people with HIV live longer, healthier lives, and if someone has an undetectable viral load, they cannot transmit HIV to their sexual partners. And this is known as undetectable or untransmittable. U is equals to U. This is game changer in the fight against HIV, as it has the potential to reduce transmission rates significantly. How we can protect ourselves, or the prevention is one of the most effective ways to stop spread the HIV. Prevention can protect ourselves for this virus. There are several methods available to help protect yourself and others from HIV infection. First one is the condoms. Condoms remain one of the most reliable methods for preventing the transmission of HIV and other sexually transmitted infections or the STIs. When used correctly, they can reduce the risk of HIV transmission by up to 99%. Second is the pre-exposure prophylactic or PrEP. It is a medication taken by HIV-negative individuals to reduce the risk of contracting HIV. It is specially recommended for people who are at higher risk, such as those with HIV-positive partners on individuals who inject drugs. When taken consistently, PrEP can reduce risk of HIV transmissions by more than 90%. Next is the post-exposure prophylactic or PEP. It is an emergency medication that must be taken within 72 hours after possible exposure to HIV. It works by preventing the virus from taking hold in the body. Next is the needle exchange programs. These programs provide access to clean needles, reducing the risk of HIV transmission among people who inject drugs. Last is the mother-to-child prevention. Pregnant women living with HIV can take medication that prevents HIV transmission to their babies during childbirth and breastfeeding, and significantly lowering the risk of transmission. The key to preventing HIV is taking consistent and proactive steps, whether it's using protection during sex, taking medication like PrEP, or getting tested regularly. A global perspective, HIV continues to be a global health challenge. According to the World Health Organization or the WHO, approximately 38 million people are living with HIV worldwide. I think you hear some cases of HIV positive here in Surigao, and that's why you need to listen carefully in this speech that I will give to you. I will deliver to you so that you can know the preventions of HIV. The highest number of cases are found in sub-Saharan Africa, where nearly 1 in 25 adults is living with HIV. There is good news. Global efforts to combat HIV have made a real difference. Thanks to education, treatment advances, and prevention programs, the rate of new HIV infections and deaths from AIDS have both been steadily declining in many parts of the world. But there is still much work to do. Many people around the world still lack access to testing, treatment, and prevention resources. This underscores the importance of continued global cooperation and funding to tackle HIV. So now let's proceed to the role of stigma and discrimination. One of the most significant challenges in the fight against HIV is the stigma and discrimination that people living with HIV faces. Stigma can prevent individuals from seeking testing, disclosing their status, or accessing care. It can also affect their mental health, leading to isolation and despair, or should we say the depressions came from other people. We must change the narrative surrounding HIV. Education is the key. HIV is not a moral issue. It is a health issue. By reducing stigma, we can create an environment where people feel comfortable getting tested, starting treatment early, and living openly with HIV. How can we all make a difference? So I will ask you, what can you do to help in the fight against HIV? first is get educated. Learn more about HIV, its transmission, prevention methods, and treatments. Second is advocate for testing and treatment. Encourage people around you to get tested and start treatment if needed. Third one, support HIV organization. Contribute or volunteer with organizations that support people living with HIV and provide HIV prevention and education. Fourth one is fight the stigma. Treat people living with HIV with dignity, respect, and understanding. Help spread the message that HIV is preventable, treatable, and manageable. In conclusion, while HIV continues to be a significant public health issue, the advances in treatment and prevention have given us tools to fight back. By staying informed, getting tested, and supporting prevention efforts, we can contribute to the ending of HIV epidemic. Let us continue working together to reduce stigma, provide support, and ensure that everyone, regardless of HIV status, can live healthy and fulfilling lives. Thank you.